So, we are another step closer to normalcy with the release of the new CDC guidance for people who are vaccinated against COVID-19. The CDC says people who have gotten their shots can be around others who are fully vaccinated without wearing masks or social distancing. So Dr. Dyan Hes is here to break it all down for us. She's the founder of Gramercy Pediatrics. Thank you so much for joining us. So this is what people were waiting for. You want us to get vaccinated, but you keep telling us that our life has to basically stay the same. So now we got a little bit of guidance. CDC says it's safe to get together with other vaccinated people in small groups, indoors if you want to, without a mask. But here's the thing. Can people who have been vaccinated, can they still spread the virus? And should people have any concerns about gathering with, other individuals who are outside of their bubble?
So we think that people who are vaccinated cannot spread the virus, but this is not 100% proven. So right now, we're still recommending that vaccinated people wear masks when they're with non-vaccinated people. However, studies from Israel are showing that there is almost no transmission once patients are vaccinated, but we just need some more peer-reviewed literature. So until that time, you could be unmasked with other vaccinated patients, but when you're with non-vaccinated patients or people, like I'm talking about patients, I'm a doctor, we wear our masks.
So, Dr. Hes, the CDC director also said the agency isn't going to update their travel guidance at this time. Let me just play a bit of that and let's talk about it.
Every time that there's a surge in travel, we have a surge in cases in this country. We know that many of our variants have emerged from international places, and we know that the travel corridor is a place where people are mixing a lot. We are really trying to restrain travel at this current period of time, and we're hopeful that our next set of guidance will have more science around what vaccinated people can do, perhaps travel being among them.
So, Doctor, let's just talk a little bit about the guidance, but also human nature. People for the last year, as you know, have been stuck indoors. They've not been able to see their family. They've not been able to see their friends. I wonder just from you, the CDC and my doctor says I shouldn't eat red meat. They say I shouldn't have more than one glass of wine per week. I shouldn't eat cold cuts, right? But I take that information and that advice and I apply it to living and I make decisions based on that. Now, I understand that these guidelines are there to protect other people, not necessarily the people who have been vaccinated. But in your opinion, does this make, is it good common sense for the CDC to issue these guidelines when, let's say, a couple has been vaccinated and they want to get on a plane and go on a vacation?
I actually think that now that patients are vaccinated, they should be allowed to travel. I think the whole goal of this program is to get the economy back, to get people to see their loved ones. We have grandparents who've never met their grandchildren. We have, so the baby might not be vaccinated and can't travel. This happens to me in my practice every day. But their grandparents want to come from England or they want to come from France. If they're vaccinated, I think they should be allowed. I think there's going to be a whole other slew of issues of proving that you're vaccinated. Did you bring your vaccination card to the airport? Do you have it on the app? Who knows if it's fake? Who knows if it's real? I think those are bigger questions of how we're going to validate that. And I think we're going to need something almost like a passport system to prove that you have your vaccination. Because, we know people will do anything to cut corners, like you said. But I think that the next step will be opening travel. I think economies, especially economies based in tourism, are suffering and people are suffering. They need to go back to work. So if you can get, 200 people on a plane to go to a country where they're vaccinated and these people need jobs to work in the tourism industry or whatnot, I think that or if your business is based abroad, I think you should let people travel who are vaccinated.
So let's talk about some of the latest sort of science on these new variants and the vaccines. A new study published in the New England Journal of Medicine shows that the Pfizer vaccine was able to neutralize the COVID-19 variant that was first detected in Brazil. So, of course, we have to always let you know that, it's the vaccine maker that conducted this lab study along with the University of Texas Medical Branch. And another recent study showed that the Pfizer and Moderna vaccines could be less effective against the variant first found in South Africa. So what does this information tell you about the variants and how the virus is mutating?
Well, we know that the virus is mutating much quicker than we expected. and we are, we were hoping that it would be more effective against the South African strain, but in vivo, not in person, but in vitro testing, where they took plasma from patients who have already been vaccinated and tested it with the neutralizing antibodies from the vaccine. The vaccines have been less than stellar against the South African strain. So we are going to probably need to have some kind of a booster at some point to protect us from the South African strain. And I'm assuming that there's going to be more strains coming down the pike, and we'll have to tweak it, every year or so, to just like we did for the H1N1 flu vaccine. We had to get a booster. So I'm assuming that that's going to happen. It was more effective against the Brazilian strain, but not as effective at all against the South African strain.
So, Doctor, as you know, public high schools right here in New York City will open back up later this month, but only students who signed up for it will take classes in person. Teachers in New York have been able to get the vaccine since January, but students can't get it yet. What do you think of this? Is it safe for students? And I think you've been saying this all along to us. You believe it is safe for students to return to the classroom?
I believe it is safe. I'm actually really disappointed because I think when parents made a decision to keep their kids at home, there was no vaccine in the fall. So you might have kept your child home because there was no vaccine. And now if the parents who were at high risk, maybe they had cancer or diabetes, maybe if they're vaccinated now, they want their kids to go back to school, but those families don't have the option. It's like if you opted out, and you're stuck with that. And I think that is completely unfair because there's thousands and thousands of kids who are dying to go back to school. They're lonely, they're not learning. The other thing is that, de Blasio has not committed to improving the online education for all the thousands of people who have to stay home. And remember, the schools are very crowded in New York City. So a very small percentage are going to go back. They're going to go back in shifts. They're going to go back, at a third at a time or a quarter of the students at a time. And, I still think it's very fragmented. For some reason, society has deemed that the teenagers don't have to be back in school. And I think these are the ones who are suffering immensely. They're lonely. They're on social media. They're not learning for high school. Some of them have to go off to college next year and have learned nothing, like literally nothing this year. They're all going to be passed, even though if they're failing their classes, because it's like nobody's failing now. So I think that, yes, it's great that we're trying to get them back in school, but what about all the high schools that are vaccination sites? Are those kids going back? Where are those kids going? I mean, there's so many questions left unanswered. And, they spin it. I hate the spin that they put under, New York City high schoolers are returning to school. I guarantee you less than one quarter at best, are going to actually be in a building 1 to 2 days a week.
Yeah, Dr. Hes, I think that's really sort of good to clarify, because they do say we're having in-school learning again, and really it's just a small percentage. And what I've also seen, and maybe this is something we could talk about at another time, but I've also seen, some reports on minority parents in particular being kind of hesitant to send their kids back because, a lot of these schools are not in the best condition. They weren't before the pandemic, and there's a real concern about whether or not enough has been done to keep kids safe. But we will talk about that another time. We got to let you go. Dr. Dyan Hes, thank you so much.
Thank you. Have a great week.